Welcome back, everyone. Sports Medicine Weekly on this Saturday morning. Steve Kashul and Dr. Brian Cole. Our website is sportsmedicineweekly.com. Our producer is Shane Reardon. Coordinating producer is Treese Ann Seeger. Dr. Cole, tell me a little bit about your clinical research studies at Midwest Orthopedics at Rush, because I know on our website we are asking people to investigate that, and if they're interested, there are certain parameters between the ages of 18 and 50, but suffering from knee pain. Tell us more about it.
Well, Steve, my day job is largely an orthopedic surgeon, sports medicine, but I'm privileged to be at Rush, which is obviously an academic institution. So it's really a group of private academic orthopedic surgeons and physicians. We're about 50 in number. And almost every individual in our group participates in some form of research. And one of the areas that has been particularly gratifying is looking at new or emerging technologies. And because the flow of patients is so large, given the referral basis for our program, that we have at least a half a dozen FDA trials of new technologies that are trying to get approved by treating legitimate conditions. So if patients, and as our listeners know, largely our proceeds go to support orthopedic research. So we're really grateful for that. That's a big part of just what we do. In fact, 20-30% of my time is spent doing research. So if people want to learn about it, certainly on my website, briancolemd.com. There's a section there, Patient Medical Professionals, that has a list of all of our clinical trials. And simply you could go to rushortho.com and see all the clinical trials that are ongoing in all the different specialties. But some of the areas of particular interest of mine are cartilage repair and restoration, taking young people who have cartilage defects who, I can tell you, when I was a resident in the mid-1990s, we would put a camera or an arthroscope in a knee, and it would be an individual, typically a runner, very active, and they'd have an area of cartilage loss. It's really arthritis, but it's a small area, so it's a local spot of cartilage loss. It's like having a cavity, or think about paint peeling on the wall. Everything else is normal except the small area where you're missing cartilage, and that causes pain and swelling and lots of disability, and especially in young people. And all we used to be able to do is just go in with a camera and shave it and clean off the edges, and that would be it. And that was, as you can imagine, not particularly gratifying. It could work in the short run, but not in the long run.
When I think of cartilage defect, I'm thinking something you're born with, but this
not
is
necessarily. No,
it's overuse. Maybe
it can be. I'd say that some genetic predilection for it. You have that gene that leads to early cartilage failure, but it doesn't have to be the entire joint. It can be just a spot. But the other thing we see it is in sports. People have traumatic injury to the joint, and they lose a spot of cartilage. Everything else is fine. There's just a small area that's missing cartilage, and that can be the demise of and cause pain and lots of dysfunction.
All right, let's bring up a real-life example of one of your clinical studies. On the phone with us is Jasmine Smiles. Jasmine is a Division I track athlete out of Youngstown State University. Jasmine, how are you on this Saturday morning?
I'm great this morning. How are you all?
Good. Born and raised in Chicago. So how did you hear about Dr. Cole and his clinical trials?
It's actually a funny story. So I was dealing with this issue when I first came into Youngstown State, and that was my freshman year. Towards the indoor season, I started having pain, and I couldn't figure out what was wrong. And then I got numerous MRIs, and then that's when I heard the news that I did have this defect. So I was trying to find the best of the best to do my surgery, because there was some talk about surgery. And once I searched up doctors that specialized in this field, Dr. Cole was the first one to pop up. And I was like, I have to find out where he's from or where he's working out of. And he was in Chicago. And I was like, this is perfect. And I knew from that time that Dr. Cole was going to be my doctor.
Jasmine, you're sweet. Thank you. Let me ask you a question. Before we did your surgery, and we'll explain what was done, if you're okay with that, how many surgeries had you had in your knee?
I haven't had any surgery. This was my first.
Okay. And were you unable to compete? Did you redshirt or step out because of the pain you were having?
I ran through the pain because I just had that drive and I wanted to continue, and I didn't want to stop running. So I did run through the pain. I don't take any pills because it's hard for me to swallow pills. So I just had to just deal with it and do either pool workouts to manage the pain or bike works workouts to manage the pain. So definitely a lot of managing.
Did your performance decrease?
It did decrease.
Yeah. So Steve, she had about a quarter-size defect in her cartilage in her knee, and there's a technique that, we've talked about it before called microfracture, which has really, had a lot of challenge because of other options. Microfracture, as you know, we've talked about Stoudemire in the past, right?
I brought it up before while we're off the air. The first time I ever heard of microfracture surgery was with former NBA player Amari Stoudemire, who played with the Knicks and the Phoenix Suns. And I remember the first time I heard microfracture surgery, and I think, our colleagues as well were like, "Oh boy, that's a serious, treatment on a knee. It's worse than anything else." But that was the perception when you hear microfracture surgery.
I think the facts get twisted. The reality is it's a really difficult problem. It's hard to manage it. It's hard to make it get better. And microfracture was one of those solutions. So when a patient didn't do well, it wasn't because it was a tough surgery. It just didn't work. So this particular clinical trial, for example, takes a pretty straightforward procedure, which is microfracture, where we basically clean up the defect. It's like having a pothole, and you make the edges very well defined through the arthroscopically or through a tiny incision. And then we poke small holes in the bone. We actually can drill holes in the bone.
How many?
About 1 to 2 every 5 millimeters. Not a lot. And what that does is it gets access to our body's own stem cells. We have cells, they may be stem cells or something like stem cells, that are little pharmacy warehouses, if you will, that produce growth factors. And they can help the body heal and form scar cartilage. It's sort of our body's best ability to heal, because when cartilage gets injured, it doesn't spontaneously heal. So we induce it to heal by drilling these holes.
It's fascinating.
So one of the challenges is that it's not always mature cartilage that forms, and it may not be a complete resolution of the patient's symptoms, or it may not last forever. So this particular technology is a variant on the theme that she had, which is where we have this, we call it biphasic. It's a liquid that's hit with ultraviolet light that turns to a solid that stabilizes the blood that is intentionally drawn into the area by drilling the holes, and kind of keeps it there to form more mature cartilage. We actually performed the goat study. It was a large animal study years ago for proof of concept. And this is a company that, they're typically private companies. They're funded through various ways, venture capital, things like that, or sometimes they're subsidiaries of very large device companies or pharma companies. And then they run these clinical trials, which are very time-consuming, very expensive, but it's the only way to now get something through the FDA. So Jasmine was, fortunate that she had the right kind of defect. Wasn't huge. It had lots of options to treat it, and this is one to sort of prove that that it could be an innovative solution to this issue, and she's now 6 months out after having this defect treated.
Wow, that's great. We're visiting again with Jasmine Smiles, a Division I track athlete from Chicago, who now participates and runs for Youngstown State University, going through a clinical research study and trial with Dr. Brian Cole, my co-host at Sports Medicine Weekly. I'm Steve Kashul on this Saturday morning here on 670 The Score. So, Jasmine, take us up to date right here, and the results of your surgery and where you're at right now.
Yeah, so I am 6 months out, and it's just been a great journey. I started 2 days after my surgery with therapy, and it was just really working on the range of motion. I didn't have much, obviously, at the beginning, but as time passed along, I saw that I did have a lot of range of motion. My therapist, Sarah, she measured me and stuck to the schedule for the clinical research, and each progress that I made, I just felt more confident. And when I did go into my 3-month visit, the physician, he touched where the spot, and normally when I was touched in the inside, in the medial of my knee, it hurt so bad to touch there because of the pain and the defect that was there. But now, when he did touch in that area, I didn't feel any pain like I previously did. So I was just so happy about that. And now I'm 6 months out, so stairs are getting easier for me. I'm able to get in the pool and just do walking, a little bit of strides, just being active again a little bit. It's helping my confidence, one, and it's helping me just to see where I want to progress and where I want to go for track this year.
Well, this is a 6 to 8 month process, as you know, to get well. That's similar to any cartilage repair procedure. It's an unusual, rare problem, and I'm honestly, you're lucky that you had the right kind of simple defect, and we feel very fortunate to be able to have the privilege of helping take care of you. So, it's great that you're willing to share your story. If people want to learn more about research that's going on at Rush, I would encourage them to simply start it. You can go to my website, briancolemd.com, or go to rushortho.com, and you'll see where all the clinical trials are. We have a number of studies, for example, in the sports medicine section in shoulder and knee, regenerative medicine, and so forth, that are really interesting to sort of really put proof to what people think is important, but we don't really have the proof to support it. So anyway, we're grateful to have you. Thanks for coming on our show this morning, and I look forward to seeing you in the office for follow-up and seeing you continue to do well.
Yes, thank you. I appreciate it. I really do, Dr. Cole, for allowing me to be a part of this study and for doing the surgery. Thank you so much.
You're welcome.
For interviewing me.
Great talking to you.
Jasmine Smiles from Youngstown State University, born and raised right here in Chicago. Great story, Dr. Cole. We're going to take a break. When we come back, kind of another avenue. It's our Ask the Doctor segment. I call it the staple of the show. Always fun questions from you, the listener. We'll tell you how to get involved in this week's question. So stay with us, Sports Medicine Weekly, only on
670 The Score.